Haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Testicular imaging. So under testicular imaging, we look at the acute testicular pain. So this is to rule out the testicular torsion. So rule out the testicular torsion or the epidermolysis. So the epidermolysis has increased vascularity. So vascularity in the testis as well as the epididymis. Next is there's a pulsed wave. There's a pulsed wave Doppler interrogation yielding to an epididymal peak systolic velocity, and this is greater than 15 centimeter per second. It is highly suggestive of the epididymis. So the high yielding, this is high yielding, and that is the highly suggestive of the epididymis. The testicular torsion, it decreases the vascularity. It will decrease the vascularity, and the whirlpool sign. What is meant by the whirlpool? The whirlpool sign is where the twisted vascular pedicel as well as the Doppler in the investigation of choice. So investigation of choice will be that of the Doppler. To learn and grow daily like this, please do subscribe.